The first question, Dr. Daniels, I was diagnosed with H. pylori. Can I use turpentine to clear it? And if so, my daughter just wants me to ask, as I have begun to take metformin, 500 milligrams once per day. Can I take both together or put off the metformin until I clear the H. pylori? My daughter is a medical doctor.
Okay, great. So first of all, it helps to understand where H. pylori comes from. The answer is tap water. So it has been isolated from tap water, and it seems that is the mode of transmission. So you must absolutely stop drinking tap water, period, done, end of discussion. Let me recommend reverse osmosis or distilled water. So, okay, so now no more pylori is being added. You just need to get rid of the pylori you already have. Good news is if you do absolutely nothing, just that one thing, don't put any more H. pylori in, you'll actually cure yourself in about 3 months. But let's say you're in a hurry. So yes, I have had experience with that, and people have done very well getting rid of their H. pylori with turpentine. Next question, what about metformin? It's probably a bad idea under any circumstance, but definitely put it off, because you may find that with the turpentine that you just don't.
Okay. Question number 2, how to cure BPPV, tinnitus, scalp psoriasis, and Lyme. I have all of these and I'm struggling every day.
Well, let's make it super simple. Why don't we just do one thing and cure them all? There you go. So what you described just by this cluster of symptoms is a profound lack of collagen. So you don't have enough collagen in your body to sustain membrane barriers and blood vessels. So, I mean, in a short, that's the problem. So what is the best solution? I would say get the Candida Cleaning Report, follow the diet, and get started on turpentine as you feel comfortable with it. And then that's the diet. You've got the diet right there. Add to it 1 to 2 pig ears per day. So the pig ears are ultra high in collagen and cartilage, and they will basically fix the problem. Now, so Dr. Daniels, when can I expect to see results? So you can probably expect to see results really within a week. It's pretty prompt. So not everything's going to be gone in a week, but you'll actually notice improvement. So I would recommend pig ears. You might be a little squeamish. Maybe you'll say, like, pig ears, that's really creepy. No problem. So you can maybe try beef tendons. Do not, under any circumstances, get dehydrated beef tendons, because they will remain plastic and rubbery and hard, and there is no way to rehydrate them. Just saying. So you want to get beef tendons, and the amount that you want to eat per day, and this is uncooked, this is pre-cooked weight, is about a ½ pound. Now, when you cook them, they're going to shrink up and shrivel up. Now, that liquid you cook them in, don't worry, don't toss it, use it as a soup base. And that, again, will give you really incredible results with the Lyme, the ringing in the ears, and the symptoms that you listed.
Okay, question number 3. What can you do for damaged veins after a DVT in the leg?
Okay, so this person's had a DVT, which is deep vein thrombosis. Of course, the best thing is just don't have any more DVTs. So the best way to not have any more DVTs is to make sure you walk every day, and it's really, you have to, because what happens is the muscles in your lower leg are going to squeeze those veins and massage them and keep them free of clots. So DVTs are actually, the cause is whatever drug your doctor was giving you, or prolonged sitting, as in an airplane flight, for example. So if you're so unfortunate as to find yourself on an airplane, then you should get up and walk every 15 minutes. And then you can also put your feet on the ground and lift your heels up about 3 inches and then down, up 3 inches and down, and keep doing those exercises while you're in your seat. Okay, so now we prevent the next DVT. So the question again is, well, how do you repair that blood vessel? So again, the blood vessels are collagen. So again, you can either do pig ears, or you can do beef tendons. Now, another thing that is creeping into the culture, it's a new cultural practice, eating boneless, skinless meat. This, if I was religious, I would call it a serious sin. And God is punishing everyone who does this by robbing them of their collagen and giving them DVTs and Lyme and everything else. So stop eating boneless, skinless meat. In other words, you know that chicken salad with the chicken breast chunks? Yeah, that is giving you DVTs and destroying your blood vessels and putting you in a serious situation that's like very, very bad. So don't do that. So if you have a menu and someone tells you that they're giving you grilled chicken breast, for God's sakes, don't order it, don't eat it. If someone puts it in front of you, pass it to the next person. Just don't do it. So you want to eat meat that has the bone and the skin. My favorite of ordinary everyday food would be chicken thighs. Got a lot of skin there and a lot of bone, and for God's sakes, suck that stuff off the bone. So once you eat the meat, you're going to notice there's this kind of funny stringy stuff close to the bone. That is the best collagen for repairing your body. So yeah, suck those bones and get all the meat out.
Okay, next question is, what do you recommend for cobblestone throat and tonsil stones?
No clue. Now, this might be a new terminology. So the real question is, so a lot of people have tonsil stones, but the cobblestone in the back of the throat is simply an appearance of kind of like swelling, and it can be really painful for these people to swallow. So what this person really wants to do is get rid of the swelling in the back of their throat and get rid of this pain, because it's terrible. So what you can do is take 1 cup of water and put in about a tablespoon of salt. You want to use like lukewarm water and gargle with that. And what that's going to do is a high concentration of salt is literally going to suck the liquid out of the back of your throat. So that's the gentle solution. Now, if that doesn't work to the degree you like, you can spike that with either clove, by making a clove tea by putting cloves in hot water for 5 minutes, scooping out the cloves, and then making salt water out of that, or by making a garlic tea, crushed clove of garlic. Garlic you have to boil or it will burn. So I like to put 2 or 3 crushed cloves of garlic in a quart of water, simmer it for 10 or 15 minutes, strain out the garlic, and then use that to make your salt water to gargle with. And what that's going to do is it's going to shrink up and help that space. So what's your real problem here? The real problem is your diet. So for many people, it's the processed food and the dairy. So again, go to the Can Do the Cleaner report, follow that diet. That diet has 0 processed foods in it. And do not, I repeat, do not add dairy products to that diet. Or your favorite processed vegan or health food, don't do it. And so having a simplified diet without these chemicals makes a big difference. Now, another fine point, let's say you have an unlimited amount of money, which is always nice. You want to cook on Monday, eat on Monday, and your leftovers you throw away or give away. Why is that? Because the little bit of time that you leave that food, even in the refrigerator overnight, it might not be spoiled the next day, but it has bacteria that have grown overnight and can contribute to your particular situation. So you want to do, let's say you live in a family, that's really good. Cook Monday, eat Monday. Any leftovers, someone else gets to eat them. Cook Tuesday, you eat Tuesday. And that's it. So you don't want to eat old food.
Okay, last question is, I never understand how a person can go 3 times a day. Isn't 1 bowel movement enough? Especially 3 is tough to go if one is doing 1 meal a day only. Please explain. Thanks.
There is absolutely no relationship to the number of meals, number of bowel movements. And so I was taught in medical school that 1 bowel movement a day is just fine, by golly. And once a week, why? That's fine too. And so what this does, though, this once a week, once a day bowel movement, is it does not allow your body to cleanse deeply. So it's really not possible to get a lot of healing going on unless you get beyond that 1 bowel movement a day. So you've got to go for 3. And so what happens then is when you eat, your food goes into your intestines, and it kind of marches along at a certain pace. And not all of it gets to the other end. And so most people, a healthy person has 15 pounds of poo in their intestines. A healthy person, exactly. So you can imagine how much an unhealthy person has. So if you have any kind of symptoms, I don't know, a headache, stuffy nose, you're probably carrying 20 to 30 pounds of poop. So you're not going to make a dent in that by pooping once a day. So if you want to change or improve your health condition, you've got to really reach for the 3.